Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years, now doing the dental brokerage for 15. Today's topic is when buying or selling a dental practice, it may be time to reconsider your dependency on dental insurance. And we'll get into that. Anyway, as you know, we have 10 employees, 2 CPA accountants, and we're available to you 363 days a year. Whoa, it's sunny in New Jersey today, but freezing. 363 days a year. We take off Christmas and Easter. Our phone number is 201-663-0935. And our websites are dentalpracticeguide.com or nationwide dentalpracticebrokers.com. Now, if all this information we're about to give you is for entertainment purposes, is not legal advice or business. If you're thinking about selling to one of the DSOs, we can give you valuable information. We work with them. We're independent of them, but we know about 140 of them nationwide. So we know who the best ones are and who's having trouble and issues and so forth. So give us a call about that. They'll often pay our commission. So generally there's no commission on the DSO sales to the sellers. In addition to that, all of our sales over $1 million, we will reimburse seller fees upon successful closing based on some small criteria. But that's what we do, and we've done that multiple times. Now, getting back to things, so what is this thing about the insurance and rethinking it? Well, let's give you an example. As you know, right now in February of 25. February 25, we have that DOGE going on in Washington, Department of Government Efficiency, and there's thousands of jobs being cut. Well, many of those people have dental insurance. Now, the average practice throughout the United States has about 70%. That's what we're finding, about 70% insurance, PPO, and about 30% fee-for-service, somewhere around there. What do you think is going to happen? You've got tens of thousands of people being laid off in the government. Now, I guess they can keep their dental benefits for a little while, but not long. And if your practice is dependent on insurance around the DC area, or insurance in general, I mean, that's a big question. If you base your income and your new patients on the people that have insurance, and now there's suddenly tens of thousands in a concentrated area, Washington, D.C., Maryland, are losing their jobs, that's certainly an area of concern for you, because your practice that you're selling is based on that, and you as the buyer, you're going to buy a practice based on the fact that there's so much insurance, and maybe you think it's easier transition than a private patient, which is a misconception. I hear this all the time. Private practices with private fee-for-service patients are hard to transition because they're accustomed to the other doctor. Well, I don't think that's true, because banks are still loaning 100% on many practices, and if they were having so much trouble in transition, they wouldn't be making loans, because nobody could afford it. Everybody would be defaulting on the loans. So that's an area of thought that you should think about. Do not, so what I'm saying is you may want to start shifting your patient base to a fee-for-service. Now, a lot of the sellers tell me, I have no choice. Majority of my patients are with insurance. Hold on a second, I'm at an intersection. You should never stay on the phone when you're at an intersection. Very dangerous, because your mind is focused elsewhere. Shouldn't talk on the phone, shouldn't do anything, just focus. Anyway, doctors tell me, well, my patient base has insurance. What am I supposed to do? Husband and wife work, they both have insurances. I understand that. But maybe the time has now come to begin shifting to the 50% of the Americans that don't have dental insurance. And you have to shift your advertising, your marketing, everything over to that. And it takes a period of time. So maybe that time has come now to begin, you as sellers, to do a shift in your patient base to more fee-for-service, which are more insulated, and maybe still keep a base of insurance patients, but maybe shift it more towards fee-for-service patients. It's something to seriously think about, because if you have a practice in the greater Washington, D.C. area, and you have thousands of patients that are now getting government, because they're cutting the size of government, and they're losing their jobs, you should seriously think about this. So if you're worried that it's hard to transition to fee-for-service patients, you may not have any you may have significantly reduced patients anyway. So just a thought. Just give that a thought. All right? Anyway, as you know, we just got back from the Caribbean, 2 cruises, and we checked out a all-inclusive. That's really something special. We want to put on a seminar there. The seminars we put on the Caribbean on the cruise ships are fantastic. So just something to think about. Food for thought. Let us know. We've already booked January 12th, 2026, Wonder of the Seas. So give us a call. Let us know what your thoughts are. We'd be more than happy to help you and book you for the next cruise. I know it's hard to think, what are you going to do that far in advance? But planning-wise, but the cruise ships fill up. Sometimes a year in advance. A lot of the better rooms are filled already. All right? So let us know, okay, team? Thank you for listening. Hit the subscribe button so you hit it with all the new videos, because we're over 600 now. And if you add all the short videos, podcasts, over 1,000. Hope you find this interesting. Great talking to you. I can't wait till spring. It's so friggin' cold. It's 19 degrees in Jersey. I wish I was back in the Caribbean. All right, team, bye.